The teacher wanted to help the student. He said, look boy, the organ that you are holding in your hand is the organ. You are a boy, I am a boy. I don't have, you don't have. Please tell that and you are through the exam. And this man thought over a period and then coolly he said brain. There I learned. This is not the way to do our experiments. This is not the way to teach. So with that I start. Let me move on. This is when we talk in terms of the topic and that, the whole area today is changing into a different format. All the time I talked about a new drug, new discovery of a medicine, which can do a lot of things for a disease. But that is changing totally changing. We are onto the clinical nutrition area. Majority of the hospitals have employed clinical nutritionists into their setup. And today, treatment is being changing over to wellness and animal welfare. I'm so thankful for this society because the society ends up with animal welfare. And I also work in animal welfare in the Commonwealth as a Southeast Asia representative for the Commonwealth. I'm really happy about that. Now coming back to the topic on this, these are the areas I talk about. How do we manage these systemic diseases? Through nutrition rather than the primary drugs. There are many, but I'll just try to cover on this, and definitely I will not cross 30 minutes. I'll say bye after that. Role of nutrition and various body systems. This is not for the point of talking on the notes part of it, because you are all nutritionists. What have we have learned from you? I have brought it together here to say, in GI system, in the renal system, in the immune system, pulmonary, cardiovascular, muscular system, what are the deleterious effects of a negative energy balance? I get a patient which is not eating, a patient which is dehydrated, and obviously to me it is an energy deficit animal. So looking at that, if I look at GI, renal system, any of these, this is what is going to be happening, and this is my basic of that. Each of these two took our time, and more particularly of late, we talk in terms of the renal, increased urinary calcium and phosphorus excretion, which leads on to hypocalcemia and hypophosphatemia, and what are its deleterious effect on the kidney function. And more particularly, it affects the glomerular filtration rate of the GFR. GFR is the key factor in the management of the renal disorders. Anything that I use, if it doesn't decrease the GFR, any drug that I use doesn't decrease the GFR, is a good thing for me. Many times drugs cannot do that, whereas nutrition can do that. Similarly, in the immune system, plenty of them. Let me not waste much of the time on this. Let me move on to the next slide after that. Common causes of the kidney disease in dogs, and just take one example of the kidney. Rest of them, I will not talk too much in detail about that. When you talk of the disease, damage to the kidney filter, infection of the kidney tissue, pyelonephritis, kidney stones, kidney blockage, urethral obstruction, hydronephrosis, and then damage to the kidney, bacterial infection, leptospirosis, toxins, neoplasms, amyloidosis, plenty of hereditary diseases, and these inherited kidney diseases are plenty today, which we all would say. There is a fellow who comes to me at 5 months of age with a cocker spaniel and says this animal has got a kidney problem. How did we diagnose this? As a routine, it went through an abdominal ultrasonography, and the kidney showed a polycystic kidney. 5-month-old cocker spaniel, and finally creatinine value as against a 1.6, showing me a value of 8.5. I fit this animal into the category of kidney failure 4 stage, and now think of the owners. The owners are such, they bought this cocker spaniel, and if I say a dog, they say, sorry, he has got a name. She's called Silky, so please don't call a dog. Reason? I married, I got this. This is my puppy, this is my daughter. And now, rest of the life I have to go on. What is I going to manage? Is this the drug that is going to manage, or is it the nutrition that is going to manage? That's the reason why I'm talking about that. Onset of the renal failures occurs at 3 months to 3 years of age. Onset of the renal failures at 3 to 7 years of age in the polycystic kidney. Some glomerulopathies, amyloidosis, glomerulonephritis, many of them, renal dysplasia, very specific breeds to it. If I'm selecting a puppy for somebody, Lhasa Apso, Shih Tzu, Eton Terrier, Chow Chow, these are the common breeds people want. And now when we select a puppy, we tell them, leave all your physical examinations. We selected cattle long ago, making the animal walk for a distance and said healthy. Then came the dog examination, wherein we started using our stethoscope, thermometer, all this to say I have all a dangling good stethoscope around my neck, buying the best stethoscope which cost me 25,000, owner will feel I'm a very great doctor. Now people don't trust even that. What they want is select me a puppy which is free of inherited diseases, genetic diseases. Now we have to select these breeds based on what is the next question, what makes us. Primary glomerulopathy is an English Cocker Spaniel, Bull Terrier, Dalmatian, Doberman Pinscher, Bull Mastiff, Newfoundland, all these breeds these days. You might ask me, do we have all these breeds? In day-to-day practice, we see all these breeds in India and even in my practice. Polycystic kidney disease in Bull Terrier, Carrying Terrier, West Highland Terrier, all these breeds of them. Amyloidosis is very particular in the Beagle. Immune-mediated glomerulopathy is in these mountain dogs and the soft-coated beaten terrier. Miscellaneous diseases, we have a specific syndrome in the Bessenji breeds. There's a breed called Bessenji. They're called Bessenji-Falconji syndrome, where it doesn't metabolize the nitrogenous metabolites, ends up in a disease syndrome. Okay, now coming back to these. Why I come back to this is, when I see an oral cavity like this, it's bleeding, the gums are very bad, and the tooth, you find quite a lot of structures there. You can see them, enamel, all being yellow. And anybody can call it is periodontitis, stomatitis, anything you can call it. But this is one of the most common symptoms in a renal disorder. Like that plenty. See the ulcers bleeding. This is because of elevated blood nitrogen levels, sometimes anemia, and these are not bacterial infections. These are because of the renal failure. You can make out all these kind of ulcers as to how they result in. Look at them, saliva, tinted like this coming out of that, looking at the animals of people. This is the first where the jaundice. Let me quickly go through all these so that I save time. Now, coming to, I'm not going to talk on the primary treatment with antibiotics, fluid therapy, etc., etc. That is not my area here. I would like to talk on the clinical nutrition part. What should I do? In any of the renal failure, 3 or 4 parameters we commonly use. What are the parameters? We do hematology, we do biochemistry, most important. In the biochemistry, blood urea nitrogen level, normal being up to 20 to 40, gets elevated, can go up to 300, 400, 500. Creatinine, 0.5 to 1.5, goes up to 8, 10, 12, 13, 15, like that. Next comes the phosphorus. Phosphorus is very, very crucial for us. Up to 6 is considered as normal, 5.5 to 6. Anything beyond that is hyperphosphatemia. This is again very dangerous for us. We don't calculate other parameters like SGMA in a routine way, but we can do symmetric dimethyl arginine. SGMA is very popular today. People are changing over to that. Reason being, creatinine gets elevated when 70% of the kidney is damaged. SGMA gets elevated when 10% of the tissue is damaged. So if creatinine is 1.8, 70% of the kidney is gone. I have left with 30. If SDMA is more than 40 micrograms, that means I have left with 90% of the kidney tissue, so I can meddle with it. Now that question is, how do I manage? So to minimize the extent of viremia, to provide adequate nutrient intake, enhance recovery of the renal function is the primary aim of this. The diet depends upon whether it is acute or a chronic renal failure. Focus on the management of the acute renal failure to eliminate the inciting cause and support return of the renal function. Dietary management is more of the medical management of the chronic renal failure. The 4 goals are prevent anorexia and body weight. These animals lose weight. We need to put them. They don't eat at all. How do we do that? Next is maintain an adequate glomerular filtration rate. Prevent the development of secondary hyperparathyroidism. Limit the production of anemic toxins. This we have a role to play. You give more protein, the end product being the blood urea nitrogen, is leading on to uremia, and probably if it increases, can lead on to hyperparathyroidism in some cases. Protein. This is the most important thing. What's happening in the recent days is, for this we have a society which is called the ICE, International Renal Interest Society, recommends everything for us. And they talk in terms of what should be done. There is, the recent one is 2024 recommendations. Earlier to that, 5 years earlier, they had talked about this shall be the level of protein. then people thought, if you restrict the total protein, what will happen? You cannot restrict the total protein because the end product of protein is protein and nitrogen. But if you don't provide, it's going to end up in a gain problem. But what you should do this is, urinic animals get into guanidinoacetic acid and other byproducts. Protein should be at a high biological value, and this is recommended at the rate of 2 to 3.5 grams per kg body weight. We now weigh an animal. Every dog, before they enter into the hospital, their body weight is recorded. So you calculate and start working on what protein you are going to use, and then recommend a diet onto that. That's the way it goes on. Protein malnutrition may lead to protein catabolism and further generation of urine toxin. This is the crucial that we talk about today. Don't restrict the protein to zero, thinking that uremia will occur, animal will die. It's not so. Inadequate intake of protein under energy, it is a renal insult and may prevent regeneration of adequate renal tissue. As such, the regeneration is very poor. You restrict further, regeneration becomes zero. Malnutrition will compounded by vomiting, malabsorption, maldigestion, and disorders of both protein and carbohydrate metabolism. Hyperlipidemia is another, and here production of eicosanoids, rhomboxane, leukotriene, and prostacyclin. All these are inflammatory in nature. And you do this, they produce more inflammation, obviously the function will get reduced. This is one of the ways to say that what is the influence of feeding different fatty acids in the glomerular filtration rate. Quite interesting, we can make out that this is the glomerular filtration rate. Fish oil, omega-3 polyunsaturated fatty acid. This is the tallow, saturated fatty acid. Sunflower, omega-6. Omega-3, omega-6. Compared to these, you can make out this over a period of 6 months and look at the glomerular filtration rate, what's happening under that. 1.4, whereas this would remain at 0.8, 0.1 like that. Modification of the diet by supplementation of essential fatty acid can modify the renal function, and that is the role of the nutrition and diet. To achieve this by any drug, I don't think there is any drug which can talk about this, which can make this. The modifying the diet, fish oil is supposed to be considered as a rich one. This is the N3 as compared to N6. N6 is cheaper. Sunflower oil, anything to talk, they are all N6, but we want is N3. The next question that arises is, many dogs don't accept the fish smell. How do we do that? Anyway, you have many companies which have brought all these products in a most palatable way, and they are available for us for the commercial use. Dietary sodium. Very important unto these. Dogs with spontaneous renal disease frequently have hypertension. We never used to earlier days talk of hypertension in animals. Reason? We never looked at it. It's something like this. Unless you look into them, you cannot be manifested at all. Something like this. Some of my teachers in the college used to say, you start telling that this disease is very common. The bosses, professor, HOD, dean will say, write a project. The moment you write a project, the disease will disappear. It's something like this. Hypertension is not there because they have not done it. You do it, you will have it. Renal hypertension, portal hypertension, regular, all are possible. Reason was, if I put the cuff around the forelimb, my imagination is the dog is going to bite me. Cat, I cannot hold at all. This is the way we talked of. But you have put animal welfare as a criteria. You do all these in the dog's environment, it will allow you to do everything. You can record BP, you can record every one of them. You can very well do that. And it's possible. So when you do that, then probably you can go to that, and probably they produce a variety of lesions in the kidney and the eye. Majority of the kidney patients come to us saying that this animal goes and dashes against a wall. Now we refer it to ophthalmology because I don't look to that as a kidney problem. You need to look to that as a kidney problem, not as an eye problem first. Dogs with spontaneous renal diseases frequently have hypertension, elevated systemic arterial blood pressure can lead to variety of lesions. Recommended level of sodium in the renal diseases is 15 to 30 mg per kg body weight against what we normally say 40, 50 like that. Reduction in sodium done over a period, a rapid reduction may lead to hypotension. Phosphorus, very crucial on this. We get cases on day one, more particularly we get patients, the individuals, owners being engineering, medical people, because they always think what they do is the best for their weight, and they say that this animal is very fine, and we do. Phosphorus levels, it is so alarming for us. dietary phosphorus restriction is very important for reducing renal fat. This daily requirement of phosphorus is 89 milligram per kg body weight, whereas a low phosphorus diet should come down to 45 milligram per kg body weight. And in the treatment, what we do, hyperphosphatemia can occur in both the situations, and there are no specific treatments to decrease serum phosphorus in both the stages, but the only option that we have is oral recommendations. Unless you use oral phosphate binders, which is again a nutritional approach, not a chemical method approach, not a treatment approach. This is purely nutritional modification, and this can change. Phosphate binders used over a period, it has been now very well documented by the Irish, wherein you have stage 1, 2, 3, 4, where it is said stage 1 patients can live up to 3 years, stage 2 patients for about 2 years, stage 4 can probably around 6 months, provided you maintain all this. Otherwise, you would declare them as they're going to die in the next 10 days, 15 days like that. Types of phosphate binders, lots of salts are available: aluminium, magnesium, calcium salts. Salts of the magnesium pose a risk of toxicity in the renal patients, hence not often used. We get plenty of these magnesium preparations. All kinds of antacids, what you get them are binders. Calcium salts may have side effects like hypercalcemia, ossification of the tissue, and calcification of the vascular system. This is dangerous for us. Don't use excess calcium, because two things when we talk of kidney failure. One is called anoxia, other is called anemia. Both are considered as insult to the kidney. Don't insult the kidney. Insulting the kidney is by minimizing the blood supply, and the other is producing anoxia. Both are bad. So anything that causes this are to be prevented. Aluminum hydroxide, aluminum carbonate are administered at 30 to 90 mg per kg per day in divided meals. Calcium acetate, calcium carbonate combined with chitosan. Many preparations are available. We pay a huge money for all this, to tell you frankly, and they do wonders in treatment. Initially, later changed out all these. Let me not talk too much about the treatment. This is another calcitriol. Many times, this is the active D-form. Talk very less about. Reason being, these are human preparations are available. The veterinary preparations are not available, and you need to give them in nanograms, and you need every 24 hours to be given orally. And these are all available human preparations. We use them. Side effect of calcitriol, you overdose, it ends in hypercalcemia. You are not supposed to do hypercalcemia. This is not to be used in hyperphosphatemic patients, as it may increase serum calcium and phosphorus, which in turn enhances soft tissue mineralization. We don't want the kidney tissue to mineralize. That's most important. This is the usual when we talk of. Why I put this is, there could be errors. Apologies, because you are all nutritionists. My point has been only this. Not many people used to say, give whatever the animal can eat. He'll come back and say, my animal eats rice, cooked rice, egg, and then he says, I can give plenty of last year wheat flour. Look at that. Wheat flour has got 372 milligrams of phosphorus. Here is a case of phosphatemia, and I start giving wheat flour in the form of chapati or bread. What is that going to cause? I'm aggravating a situation. These are basics of them which has to be altered, and this is where clinical nutritionists play a major role in the clinic to turn and modify all these diets. And anyway, the commercial diets are all with this kind of anyway, but everybody cannot afford a commercial diet. This is the influence of dietary phosphorus restriction on the life expectancy of the dogs with chronic renal failure. This is the percentage of dogs surviving, imagine there, with different ways of phosphorus at 0.4% phosphorus. This is at 1.4%. Look at the duration there. How long they can live? The quality of life, 24 months they can live with high BF diet. And this restriction alone is a criteria to prolong the life of renal failure patients. Many others like herbal preparations, supplement, nutraceuticals, all are playing a role. And diet, finally to say, reduce protein, reduce phosphorus, sodium content, and neutral effect of the acid balance, supplementation of omega-3, addition of antioxidants. These are the primary things required in the diet parameter. These can we think of homemade diet versus commercial diet. Many will think we can prepare a homemade diet, and you are better known than any one of us in the palatability of a diet. People think I can mix everything and give to a dog. It's not like a cow where you can make them eat everything what you prepare. Why should he eat or she? You think my diet is something special. Prepare the way I want. So that's how homemade diets are cheaper, economical, easy to prepare, but the animal will not eat. Your nutrition things will satisfy all the requirements, but the animal doesn't eat. So then again, dry food versus semi-solid diet, liquid diet versus ethanol feeding. These are all things which go on. Let me not take you on to that. These are all the areas probably need a lot of research and everything. This is one of the Irish recommended recipe for the CKD. You can use restricted purine, phosphorus, ultra low protein diet, 2.5 cups of cooked rice, vegetable oil, hard cooked egg. Egg is a good thing, calcium carbonate, potassium. Prepare this and feed them if owner is not able to afford a commercial diet. Prognosis of the kidney failure, this is what I was talking to you. Imagine stage 1, 2, 3, 4, all these we can make them survive for a longer period, and the nutritionists have played a role. I would say in my practice, after this, I'm so confident to tell people, don't worry, your dog will be with you for a longer period. Otherwise earlier, when I had cases with 18, 19 and no dialysis being done, peritoneal dialysis doesn't work, we have to go for a hemodialysis, and these patients to go for a dialysis is so tough. The breeds what I talked about like Shih Tzu, their whole body weight is around 5 kilos, 6 kilos, and my tubing will take 300 ml blood, and the whole blood in the animal is 500 ml. So how do we do the dialysis? It's very easy to talk, but practicality is very, very difficult. So we need to depend on diet, and diet is the whole thing on that. Issues, use of dopamine, use of N-acetyl, use of amino acids, all these are research based. I'm sure people will get interested, and you make a proposition for us, we will put them into practice, how their roles are. This is one of the new things which has come. Supplement this, it can prolong the life, and I'm sure you will find answers and you will give me answers over a period. We get this done, give it to animals because these are not commercially available. These are all proven, some literature which says animals' life can be improved, longevity can be increased, quality of the life can be improved by these combinations, and these are all used products. Urolithiasis is the next stage. Caliculi, maybe the kidney stones, ureter stones, bladder stones, and all these. Quite common both in dogs and cats on a regular basis. Different kinds of crystals there. Most common being struvite urolithiasis. We always use the calculated diets. In the absence of the diet, we use only preparations. Again, no chemical preparation available. We depend on herbal preparations. Herbal products are much better. Otherwise, you have to go for lithotripsy or surgery. In the absence of that, diet is the only thing that can help us reduce quantity of high quality protein, phosphorus and magnesium, and are supplemented with sodium chloride to stimulate the thirst, and that can be better after that. These diets are not recommended for patients with heart failure, nephrotic syndrome, hypertension, or growing pains. So diet which are prepared are for a purpose, for a specific cause, and not for everything. Calcium oxalate urolytes again very common, urate urolytes are common. All these diets are available. Let me not talk too much on that. The next most important is obesity today. In the day-to-day practice, what we get here is obesity is the primary thing. That's the same issue in humans versus animals. And all these canine obesity can lead on to reduction in longevity, osteoarticular diseases in the form of arthritis, cardiorespiratory problems, diabetes mellitus is increasing like anything today. Maybe every doctor will say, every practitioner will say, I have a patient, I have 10 patients on diabetes mellitus with me. Then dystocia, reduced immunity, mammary tumors are more common, skin infections are plenty, surgical inconvenience, urinary incontinence and urinary calculi, reproductive problems, dermatosis, plenty, all related to obesity. So then how do we address this? Look at this man, he comes happily to me, he is carrying a 45 kilo Labrador, and its weight, maybe based on book, you will agree that it should not be more than 35 plus or minus 2, 37 as the maximum. And 45 kg, everybody is very happy that I carry everywhere, wherever I go. I have one car seat fully for him. Waters. Then now look at the water, he will be 110 kilos. Because he has to carry this and he will put on more weight again and again. These are again problems of that kind, not a good way. Not to go into the detail, these are all standards which are carried. Each of the breed. What is more important for a veterinary practitioner today is a nutritionist, a clinical nutritionist has a more role to play. A human nutritionist has got maybe a male and a female, a geriatric patient and a pediatric patient and a neonatal patient. Look at this, all these categories in each of these breed, meaning to say a Chihuahua which is 2.5 or 3 kilo to a Newfoundland or an English Mastiff which is 110 kilos. Same nutritionist to formulate a diet for everybody? Is it possible humanly? What I do for Chihuahua, is it a diet for Newfoundland? Definitely not. That's the reason I give this, and probably all these need totally different things over a period. I've taken them in the order. Sharp eyes, Siberian Husky, Collie, everything of the breed. For a male and female, everything is different after that. Let me skip all these. Rottweilers, then Burmese Mountain Dog, French Mastiff, Bull Mastiff, all these are very common today these days. People want that. Okay? Bigger car, bigger weight, bigger arm. Okay, that's the way it's going. Mastiffs, look at them, 87 kilos sometimes. Now grading at the body weight, what we go by, everybody feels very happy about that. First, one of the nutrition workshop which I attended in US, I went through a course for about 3 weeks on that. They said, do a thorough physical examination, not as a medicine man, from a nutrition point of view. How you are supposed to examine an animal? Put on the table or put down, keep between your legs, evaluate each organ, palpate, then grade everything after that. That's why this is the kind of scoring what happens. You have a 1 to 10 scoring and 1 to 5 scoring. But to a common man, what you should think is, keep the dog under his way and examine the dog from these sides of this way, not like that. And when you do this at the rib area, if you are able to palpate the rib, this is an ideal dog weight, irrespective of the size that you take. If you are digging into the rib, that means this is already 4.5, you can easily take it. And a body score beyond 4.5 is about 13% of the dogs. And you tell them, he is 45 kilos. They say last month when I came it was 50. No, he has already reduced. 50 kg come down to 45. Adult weight is 25 kg. He is double the weight. And how do we reduce? Very difficult to do that. Anyway, the crash plans which occur and the requirement of protein, everything as per the list, we try to follow all this. Very difficult. For us to spend time to work, make the owner convinced, change them and talk to them, this will help you. Very difficult to do. Maybe they'll all come back and say, anything that you recommend, the standard statement, the slogan goes, you recommend. Normally what we talk about the medicine, we say before food, after food. Give a medicine, before food, after food. Diet when I come to, same thing happens. I recommend a diet, then he said, this is before food or after food. I already want to reduce the diet, but his contention is what he is giving plus what I am giving. This is the way it goes on. So convincing is very important. Communications are very important. That's where we talk of communication skills among the professionals is very poor because we are unable to convince them why we should provide. It is not to supply, it is not to market somebody's dog food we are trying to do that. It is to improve the quality of life is more important than that. These are the particular ingredients what you should use on them like L-carnitine, chromium, right?
Yeah.
Also, chromium or vitamin A, etc. all these. Let me quickly go through and then come on to the GI disorder. This is where I talked about it again. Will you give me 5 minutes? I'll end up. 2 minutes? Oh, okay, 3 minutes. I'll end up. GI disorders are plenty. I'll not detail all these kind of things. Let me go to the next phase of that. Many diseases which all cause unto that. Severe, potentially life-threatening acute gastroenteritis like infections, hemorrhagic disease, intersusception, valvulitis, plenty. Acute gastritis, acute enteritis, acute colitis. Resting the gut is the most important. Feeding through diarrhea is phenomena. Chronic gastritis, plenty of causes of them. And what is more important is they should be fed multiple small feeds. Wet food should be warm, dilute with water, liquid low osmotic, diets must be highly digestible. These are the way it should go on. Let me skip all these. Each is a diet for a GI disorder like gastric dilatation and volvulus. And then these are the conditions what we go by. This is extensions of that. All of the GIT problems end up in many kind of conditions. Intestinal diseases for large animal diseases. And these are again very specific conditions like GLG, EPI, exocrine pancreatic insufficiency, small intestinal bacterial overgrowth, personal diseases, and all these plenty again. Let me quickly finish with all that. Rice and corn do not contain gluten, so in the dietary management, use them. Dietary management of IBD, dietary sensitivities, treatment of dietary sensitivity, okay, and goes on. Hypoallergenic diets, plenty are available. Congestive heart failure is another area which all needs that. Restriction of this protein. Taurine is more important. L-carnitine is very particular. I would like to make a mention. L-carnitine is one what has to be used, not the D-carnitine or the DL-carnitine. Don't have to use that. Carnitine is very important. Arginine, egg is a good source of arginine. Wherever you talk of arginine, use arginine. This is hypokalemia, magnesium deficiency. All these are common in congestive heart failure. Take care of all of them. And then free radicals, everybody talks of these in the dietary pattern. You need to use them. And then comes the homemade recipe for the congestive heart failure. Okay. Hepatobiliary diseases, again plenty of them. I think this is getting covered tomorrow and Dr. Ramesh is going to speak, so I'll skip all this. Then I'll come to the last part of it. Okay. Okay, once again, let me come to the last part. Some of them which I wanted to say on that. Okay, now let me come on to 2-3 slides on that. These are the new area what you talk about. Look at this dog. This is a husky. Everybody is very popular. Look at the lesions there. Anybody would say this is conjunctivitis, skin disease, etc., etc. Very common. Zinc responsive dermatosis. They are very specific. They respond to only zinc, nothing else, no other treatment required. Plenty of cases are there. See that. Lesions like this. Bacterial, fungal, metabolic, so many things like that you can talk about. Worst of them. This is typically called spectacle appearance. This is zinc deficiency. Okay? Again, Rottweiler. And this is the other worst of them. This is again a metabolic disorder. Anybody would say these are all leg problem, foot problem. These are again deficiency diseases, nothing else. Look at the lesion as well. This is called as SND, superficial necrolytic dermolysis. It produces the tissue to be totally lost. Animal can never get up into that. Okay, to summarize, let me come. Since excess protein intake causes a progressive decrease in the renal function, a diet with high biological protein with highly digestible content of 14-17% can be fed. Phosphate binders and fatty acids, particularly omega-3, provide good quality protein. Restrict sodium in the renal diet. Supplementation of taurine, arginine, L-carnitine are very important. Prescription diet plays a role. Commercial diet versus homemade diet. Nutritional management can help in improving the quality of life and also helps in improving the longevity. Thank you very much. Sorry, I've taken a long time. Thank you all for this. And thank the society for giving me an opportunity to talk to you all and to put my insight into this. Thank you very much again.
Thank you, Dr. Yathiraj. Dr. Yathiraj has given very good information about the nutritional